11 new cases reported in the state today. Total number of cases with this in Karnataka has risen to 258. Number of deaths also rises to 9 in Karnataka. 3 new cases reported from Bagalkot, 3 cases reported from Kalaburagi, 1 from Chikkaballapura, 2 from Bengaluru Urban, 1 from Vijayapura and 1 from Belagavi. COVID-19 has claimed another life in the state. A 69-year-old man has succumbed to COVID-19 in Vijayapura district. With this, the death toll has risen to 9. Meanwhile, 11 new positive cases also have come to light. 11 new cases have come to light, and of course just yesterday 2 people unfortunately also succumbed to the deadly virus, which still does not have a cure. What more do we know about these 11 new cases and their travel history?
Absolutely, Neha. Right now, that is the news that we're tracking. 11 new cases in Karnataka, taking the total to 258. And as we speak, the number continues to rise. And as there is an extension of lockdown, several measures by the government, the cases continues to proliferate across the city and across the state. We have 2 new cases from Bengaluru. Let's just start with Bengaluru first. Bengaluru Urban, we have 2 new cases. One is the symptom, a case by SARI, which is severe acute respiratory infection. So this clearly, these are the cases that the authorities are actually keeping an eye on, because these are the cases where you do not have any information of travel history, contact history, and there is no information as such about how exactly a person contracted the coronavirus. So these are the cases that the authorities have been trying to actually understand and get an information about. And there is another one in Bengaluru today, and this is patient number 252 that we're looking at, and this is the same person who has expired as well. Remember, this person had primary contacts of about 25 people. 25 people actually lived in the same house as this man, and these are all identified as primary contacts, and they have been shifted to a designated hospital. And most likely, you probably expect almost everyone to be infected. That is the sort of situation that we're looking at here. It was a small place where he lived in. It was a small slum, in fact, that he lived in, and there were people living together. 25 people that we're talking about, 20 to 25 people. So that goes on to show, the sort of outbreak that we're in fact looking at. Moving on, we are tracking patient number 248, who is a 43-year-old from Bagalkot, contact of patient number 186 and patient number 165. So who are these patients? These are patients who had a travel history to Delhi. Now, whether they attended the Tablighi, the Nizamuddin Markaz is something that remains to be unknown, but these are patients who have a travel history to Delhi, and this is what we're tracking at the moment. Bagalkot, you have 3 cases who have come in contact with someone who's traveled to Delhi. So all of these cases that we're tracking at the moment have some or the other sort of travel history or contact history. Majority of these cases have that, so that is one silver lining. But having said that, one case from Bengaluru is the one death that we're looking at without any sort of history, and the fact that that person had come in contact with so many people, so many primary and secondary contacts, that has become a big headache for the authorities at the moment. Clearly, numbers are rising in Karnataka, not just in Karnataka, but across the country. We are seeing a proliferation in the number of cases and deaths. Constantly there is, the tally is crossing 900 every passing day, and in the state as well, it has become a norm to see the digits the double-digit figures of the number of cases that we're looking at. Earlier on, you had the cases from certain areas, but now as time passes, you have new districts where more and more cases are popping up, and that has actually become a big headache for the authorities.
That's right, Ashish. Till now, of course, 11 new cases have been reported, 65 people have been discharged, and we had the information that only 8 people have succumbed to the deadly virus. But now, as per the midday bulletin, it's actually 9 people who have died. So do we have any information on the 9th person who has succumbed to this virus?
Absolutely, Neha. The 9th person who has succumbed to this virus is 69-year-old male from Vijayapura, and this person had come in contact with patient number 221. In fact, this person is the husband of patient number 221, and he has now expired. So We believe that is the 9th death because the last bulletin we had gotten information about the 8th death, and that is what we're talking about. The person from Bengaluru, the death in Bengaluru that we're talking about, that was the 8th death. This is the 9th one, male from Vijayapura who has now expired, and that is the latest that we're tracking. Now this person was the husband. This person was the primary contact of patient number 221. So that is the information that we have at the moment, Neha.
Right. Thank you very much, Ashish, for joining us with all of those details. We'll keep coming back to you throughout the day. Well, 11 new cases have been reported in the state just today. Patient number 248 contracted the deadly virus from patient number 186 and 165. Patient number 249 contracted the deadly virus from patient number 186 and 165. Patient number 250, a 65-year-old male, patient of severe acute respiratory infection.